Hi everyone, welcome to week 3 of your Pharmacology 2 course. This week we are covering chapter 16. And chapter 16 is all about drugs that are used for psychiatric conditions, so psychiatric drugs. So we're going to look at the different therapeutic effects and the different categories of drugs that are used to treat the different types of mental illness. And we're going to be looking at some of those specific types of mental illness too. One of the other things we're going to be doing is looking at some of the dietary restrictions for patients that are taking categories of drugs in this class. And then, of course, generic names and things like that. So when we talk about psychiatric drugs, we're talking about drugs that are used to treat different diseases of the mind, which are known as mental illness. So those can be any kind of emotional disorder that involve abnormalities of the personality, the mood, or a person's behavior. About 50% of hospital admissions are related in some way to mental health. So it's a very big issue in our country in general. These are just some of them that are listed: anxiety, depression, suicide, postpartum depression, psychosis, eating disorders, panic attacks, social phobias, easy for me to say, right? Obsessive compulsive disorders, psychosomatic illnesses. So these are things that you think you have, but you really don't. Attention deficit disorders, PTSD, drug addiction, alcoholism, all of those things. So really, in the history of mental illness, a lot of times they were treated by just giving them alcohol or opium. So, basically trying to just subdue the symptoms more than anything else. And so a lot of those things obviously have changed over the years, and barbiturate drugs have been limited to just treating insomnia and pre-op sedation and that kind of thing. They are not used for psychiatric purposes anymore. So some of the drugs that are used are going to be things like what they consider minor tranquilizer drugs. So yeah, it's kind of like they say here, it's just they're totally unrelated to what we consider major tranquilizers like the barbiturates. They're effective. They're used to treat different types of neuroses. We have benzodiazepine, which are anti-anxiety drugs for neurosis and anxiety. Those typically affect the thought process, and they decrease that muscle tension that comes along with anxiety. Some of them that are in that category that you might be familiar with: Xanax, Librium, Transine, Valium, Ativan. Those are some of the more common ones. Also notice as you go through these slides, by the way, look at these pictures, because they're going to show you a picture of what an actual bottle will look like. So this is the generic for Xanax. One of the ways you can tell a brand name from a generic name when you look at the label, if you look right here, you can see that this is alprazolam and it's a lowercase. If this were a brand, it would typically have an uppercase letter. You can tell it's a prescription drug because it has RX only on here. You can see the drug strength, 1 milligram. You can see how many are in the bottle, 100 tablets. You can tell who makes it, in this case, Greenstone. And then the NDC up here at the top is very important as well. One other thing to notice on this particular label is this C with the Roman numeral 4 in the middle. That tells you that it's a scheduled drug or a controlled substance. So that's very important information to be able to identify on a label as well. So here's another one. This is an actual injection. Again, you can see the C4 right there. You can see RX only, and then you can see here what the strength is. So what this says is it's 10 milligrams per 2 milliliters. And then it also tells you what it is per milliliter. So this little bitty thing right here says 5 milligrams per milliliter. You can't see the the NDC on this one or the manufacturer. It's typically, since this is such a small syringe, it's probably on the other side. Now let's see, what other things did I want to make sure to point out to you this week? Just there's a lot of history that they talk about in here as far as how we treat it and how they've discovered what's the best thing to treat. We've also got things that are within the Schedule 3 that are used. This is an example of a drug that is a non-scheduled drug, so it's not a drug that is a controlled substance. You can see it's hydroxyzine, and then there's the NDC up at the top. You can tell it's 50 milligrams per mil. And this particular vial contains 1 milliliter in a single dose. It's for intramuscular use only, prescription, and it's made by American Regent. So I just want to point out some of those as far as how to read those labels. Some of the things that are used to treat some of the social anxiety disorders, so those types of things where you're just not able to maybe, deal with folks in a face-to-face setting. We've got different types of Schedule 4 drugs again, Xanax and Klonopin, that are used. We have some antidepressant drugs that are actually successfully used to treat panic disorders and things like that. So what we call the selective serotonin reuptake inhibitors, things that fall into that class, as well as the serotonin and norepinephrine reuptake inhibitors. So you'll see them abbreviated SSRI and SNRI. Some of them in those categories are going to be used for panic disorder. And then, of course, we have things to treat psychosis and schizophrenia. Again, a lot of history that you'll be looking at in this particular chapter. One of the things I wanted to point out before I, end what I have to tell you, the highlights of this particular chapter. First of all, I want you to make sure you understand this. Most of the time, a physician's going to recommend what's called a drug holiday from an antipsychotic drug. So it's basically so we can make that switch from one to another, or to, to see how they're doing, that type of thing. So that's really important to understand what a drug holiday would be. Typically, you're not going to see them do a quick switch from one to another. There's going to be some sort of break in between. And then the other thing I wanted to point out to you is something that I actually saw recently. I was on, my husband and I were watching TV the other day, and it was a really great documentary that I'd like to encourage everyone to take a peek at if you get a chance. Let me see if I can pull it up. This is the website for it. It's called God Knows Where I Am. And that's just the name of the documentary. I would encourage you to take a peek and see if you can find it on Netflix or YouTube or something like that. This is a really moving documentary that talked about this woman's struggle with mental health and how it was treated. So if you have the opportunity, take a peek, because this was a great video or documentary, like I said. So if you have any other questions throughout the week, please make sure that you reach out to me, and have a great week.